Hello everyone, I am Lance Wilkerson at Deaconess Clinic Urology, and we're with urologist Dr. Joe Klink. And in this video, we're talking about Prostate Cancer Awareness Month, and 1 in 8 men experience prostate cancer. And first of all, talk about prostate cancer and the importance of getting screened early.
Certainly. So it's very important to be screened for prostate cancer because there are no symptoms for prostate cancer. That's something that a lot of men don't understand. I hear it all the time. People say, well, I'm feeling fine, nothing's wrong. Well, with prostate cancer, you don't feel anything until it's much, much too late to cure it. So that's why we need to screen. Men need to be screened once a year if they have a reasonably long life expectancy to make sure we find it early while it still can be treated.
How does someone get prostate cancer? Is it hereditary? Is it diet? Or do we know?
So there are a lot of factors. Honestly, most men, we never really find out why they have it. There is definitely a hereditary component. So especially if your dad or your brother had prostate cancer, you're at much higher risk of having it yourself. So that's very important in those cases, especially to be screened. There are several other factors that play into it. In some people, a poor diet for a lifetime, some other minor things, but for the most part, it's rather random. Actually, anybody can get it, so nobody's safe.
And for men, what age should they start getting prostate cancer screening?
The age of screening, you'll hear different numbers from different people, but in general, a good way to go would be a baseline PSA and baseline screening at 40 and 45, and then once a year starting at 50 until you're within 10 years of your life expectancy. The screening is actually fairly easy. PSA is a simple blood test. But then there's an exam by your doctor also that's an important part of the screening.
And if someone unfortunately is diagnosed with prostate cancer, what is that treatment like?
So fortunately, if you get screened and we catch it early, most men we can cure with treatment. It could be surgery, could be radiation, could be some other things. But that's one of the reasons why we want to catch it early when you still can cure it. If you wait and don't catch it till it's advanced, unfortunately, then it's not curable. And there's many treatments we can do with hormones or chemotherapy or other things, but none of them cure it, which is why it's so important to get it caught early while it still can be cured.
And more to that point, you know, some people like to put it off. Guys can be that way too.
Definitely.
Or they go every 3 years. If someone's stubborn like that, what would you say about you really need to get it annually?
Exactly. You really need to get this done every year because if you put it off, it could make the difference between life and death, unfortunately. Hopefully not, but we see that. We see guys who decided they weren't going to get screened and one day they come in and unfortunately by then it's too late. So please get screened early. Get screened at least by 50, if not before.
Absolutely. And Dr. Klink is accepting new patients. You can go website on the screen, deaconess.com/findadoc, and put in Joe Klink, or you can call the phone number on your screen. Well, thanks so much for your time, Dr. Klink. Really appreciate it.
Thank you.
That is Dr. Joe Klink. I'm Lance Wilkerson. Thanks for watching, and have a great rest of your day.